Welcome back to The Explainer. Today, we're unpacking a topic with some incredibly high stakes, but also enormous life-saving potential. We're looking at a disease that strikes fear into the hearts of many, yet it harbors a really surprising medical truth. We're going to demystify esophageal cancer. By the time we finish today, you're going to understand exactly how this silent threat operates, and much more importantly, how modern medicine can completely stop it in its tracks. Now, it's a completely fair question to ask. Is esophageal cancer just an unstoppable disease? I mean, if you followed the news over the years, it sure feels that way, right? So many famous and beloved figures have fallen victim to it, making it seem almost invincible. For instance, the famous Japanese rakugo storyteller, Danshi Tatekawa, who battled it alongside throat cancer, and the acclaimed actor Makoto Fujita, a known heavy smoker who succumbed to this illness. Even the legendary manga artist Fujio Akatsuka, known for his heavy drinking, faced severe risks tied to this very condition. When we hear these names, the disease sounds like an absolute death sentence. But is it really?
Well, let's dive right into this, because the medical data actually reveals this massive paradox. According to the experts, if you catch this early, over 90%, actually nearly 100% of cases, can be completely cured. Literally cured. It's not a death sentence if you beat the clock. Need proof? Look at the famous musician Kyusuke Kawada, who was diagnosed at age 54. Because it was caught early, he was treated, fully cured, and remains highly active today.
A deadly but curable threat.
To really appreciate how incredible that near 100% cure rate is, we first have to confront the grim reality of what happens when it's not caught early. We got to look at the baseline statistics. When doctors talk about a cancer's outlook, they look at the 5-year survival rate. If you get prostate cancer, the 5-year survival rate is an incredibly high 99%. Stomach cancer, a solid 75%. Colon cancer sits at 70%. But esophageal cancer sits at a grim 45% overall 5-year survival rate. That means, on average, if you were diagnosed with this disease, only 1 in 2 patients will survive past 5 years. It's a coin toss.
Moving on to Section 2, the anatomy of fast spread.
So you're probably wondering why the massive drop-off. Why is this specific cancer so much deadlier than stomach or colon cancer? Well, it all comes down to basic human anatomy. We need to define a crucial medical term here, the serosa. The serosa is essentially a tough, protective outer membrane. Think of it like a thick physical barrier. Now, moving abdominal organs, like your stomach and colon, are totally wrapped in this serosa to protect them as they churn and move around your abdomen. It acts like a shield against spreading disease.
Now, what's really interesting about this is the massive anatomical contrast. The stomach and colon have that tough serosa. You can think of it almost like a strong sausage casing. But the esophagus, that roughly 25-centimeter tube running from your throat to your stomach, it's fixed directly to your spine. And because it doesn't move around like the stomach does, it completely lacks this protective casing. There is absolutely no serosa on the esophagus.
And honestly, that missing casing is the fatal flaw. Without that physical boundary, the cancer can easily and rapidly spread outwards. The esophagus is surrounded by a really rich lymphatic network, meaning the cancer can jump into your lymph nodes super early on. And worse, sitting right next door are vital structures: your heart, the aorta, the trachea, the lungs. The cancer just silently invades these crucial neighboring organs because there's literally no biological wall to stop it.
Okay, Section 3, high risks, alcohol and genetics.
Knowing how insanely fast this spreads, we really need to know what triggers it in the first place. And the primary risks are incredibly clear. The 2 absolute biggest culprits are alcohol and tobacco. Smoking, of course, introduces direct carcinogens, but alcohol is uniquely dangerous here because of a toxic byproduct called acetaldehyde. Oh, and constantly drinking excessively hot drinks? That actually inflicts repeated thermal damage on the delicate surface tissue of your esophagus, which basically paves the way for cellular mutation down the line.
So the absolutely crucial point here is this specific number: 40 to 50%. That is the percentage of Japanese people who genetically lack the specific enzyme needed to efficiently break down that toxic acetaldehyde in the liver. If you drink alcohol and your face turns red, you know that flushing reaction, it means that toxic acetaldehyde is pooling in your body. And since acetaldehyde is a known carcinogen, if your face turns red when you drink, your risk for esophageal cancer absolutely skyrockets.
Let's look at Section 4, stages and survival rates. All right, we know the risks and we know the anatomy.
Now we need to look at the timeline. Cancer staging shows us exactly how time dictates the absolute difference between life and death. If you track the cancer as it deepens into the esophageal wall, you see a terrifying plunge. At stage 0, the cancer is only on the very surface mucosa, and survival is practically 100%. But as it pushes into outer layers and lymph nodes, those numbers plummet. By stage 4, where it's spread to distant organs like the liver or bones, survival is a devastatingly low 5 to 15%. I mean, the drop-off from stage 0 to stage 4 is just a massive, terrifying plunge. Time is literally everything here.
Which brings us to Section 5, the endoscopic cure, or ESD.
But remember that massive paradox we talked about at the very beginning of this explainer? Let's pivot to the uplifting modern medical miracle that makes this highly deadly cancer highly curable. If you catch this disease at stage 0, you do not need open chest surgery. You don't need intense, agonizing chemotherapy or radiation. You literally just need an endoscope. The procedure is called endoscopic submucosal dissection, ESD for short. It's a minimally invasive technique where doctors cure the cancer from the inside with absolutely no major cutting through the skin and no stitching.
Let's dive in and see how this builds, because the procedure happens in 3 incredibly precise steps. First, the doctor inserts a camera down the throat and meticulously marks the exact boundary of the surface cancer. Step 2, they use a tiny needle right through the endoscope to inject fluid underneath the cancer, which physically lifts that diseased layer up and away from the deeper muscle wall. And then step 3, using a specialized microscopic tool, they carefully scoop and peel that entire cancerous membrane off in one single piece. Boom, the cancer is completely removed. And because there's no open surgery involved, the recovery is just astounding. A patient's hospital stay is typically just 5 to 7 days. They're usually discharged in under a week. And the impact on their long-term quality of life? Basically minimal. Aside from needing some regular checkups and, cutting back on those high-risk habits like smoking and heavy drinking, they get to return to their completely normal lives.
Section 6, don't wait for symptoms.
Guys, this brings us to the absolute most important takeaway of this entire explainer. Early stages have 0 symptoms. I can't stress this enough. You absolutely cannot wait until you feel sick. Stage 0. The stage where the cure is simple, quick, and essentially guaranteed is completely silent. Your body is not going to give you a warning sign.
If you do wait for your body to warn you, you're waiting for late-stage signs. When the cancer grows large enough, you might feel a tingling or a burning sensation in your chest. As it narrows that 25-centimeter tube we talked about, you'll literally feel like food is getting stuck on the way down, causing difficulty swallowing. But listen, if you wait until you experience these red flags, the cancer has likely already progressed far past stage 0 and into those dangerous later stages where the survival rates just absolutely plummet.
So, what does this all mean? Well, it leaves us with one final, incredibly provocative thought to close out this explainer. If you're over 40 years old, and especially if you fall into those high-risk categories, meaning you smoke or you get that red flush on your face when you drink alcohol, you have the power to stop this silent threat before it even starts. Modern clinics use sedatives, meaning you literally take a light nap and the endoscopy is over in about 5 minutes. So are you ready to book that painless screening? A 5-minute sleep could literally be the difference between a devastating late-stage diagnosis and a 100% cure. Get screened, stay informed, and we'll see you in the next explainer.